Welcome to another episode of the News Roundup. On today's show, we'll be discussing two stories. The first deals with the Omicron wave, which is shattering records of infections in Israel, with 17,362 new infections reported back on January 5th of 2022. This even as the fourth booster program has commenced in Israel. We'll discuss what is going on there. And then for our second story, we're going to talk about a doctor in Pennsylvania who has been fired for not taking the COVID vaccine. Another instance of a COVID-19 based division in the medical community, as this doctor was the medical director of Doylestown Health's Woodall Center for Heart and Vascular Care in Doylestown, Pennsylvania. And so, from TrialSite News, I am Adrian, and our episode starts now. So, the Omicron variant of SARS-CoV-2 now rages throughout the eastern Mediterranean nation of Israel, as the reported number of cases has hit COVID-19 pandemic record of 17,362 new infections back on Monday of January 5th of this year. Now, as we here at TrialSite News recently reported, a fourth booster program has commenced, targeting higher-risk demographics such as the elderly and immunocompromised. Although the sweeping variant of the virus seemingly has milder symptoms, it does demonstrate in this heavily vaccinated nation the limitations of the mass vaccination strategy set to eradicate SARS-CoV-2. TrialSite News has shared with our readers that by October and November of last year, based on Israel Health Ministry data, that although the unvaccinated still faced a higher risk for severe infection, there have also been reports of striking numbers of breakthrough infections leading to hospitalization. One Sheba Medical Center study opens up a Moderna arm, which begs the question: are there some underlying seeds of doubt concerning Pfizer's BioNTech BNT162b2? Now, the good news is that despite historically high infections, the death rate here is very low, at least so far, based on data from the COVID-19 Data Repository by the Center for Systems, Science and Engineering, or the CSSE at Johns Hopkins University. Although we here at TrialSite News cannot be certain what's behind the lower death rate, there has been speculation that a confluence of factors from vaccination and growing natural immunity to the milder mutant strain could be the explanation here. So, in this way, mass vaccination proponents will claim that the products made the pandemic milder. However, the fundamental underlying assumptions for what is now hundreds of billions of dollars spent worldwide on vaccine-supporting programs was very much centered on pathogen eradication, something the vaccine products are failing to address. And as recorded deaths from the virus worldwide are reported at nearly 5.5 million, some critics, among them critical care physicians, have argued that early treatment to the virus should have been part of the focus all along. Meanwhile, back in Israel, Sharon Alroy-Prius, the nation's top public health official, told Channel 13 that there is no control of the Omicron wave, speculating that perhaps no one is protected from infection. And so it would appear that avoidance of economic pain and suffering is becoming a top goal of governments across the West as the realities of the situation have settled in, meaning the transition to an endemic stage and learning to live with SARS-CoV-2 pathogen. As Prime Minister Naftali Bennett declared at a recent press conference, it is a different ballgame altogether. Now, regardless of potential vaccine limitation, the fourth boost program accelerates to full throttle. Israel 21C reported that thousands have started getting their fourth booster shot of the Pfizer's BioNTech mRNA-based vaccine last week, since the government authorized use of healthcare workers, the elderly and immunocompromised. The rationale for this decision? Protect the vulnerable from the imminent Omicron wave. It is worth noting that this decision was made prior to an important Sheba Medical Center study investigating the impact of a fourth dose on 150 employees at the academic medical center. Israeli media has reported that all those subjects that received 3 Pfizer-BioNTech doses 5 or more months ago now don't have sufficient antibodies to respond to SARS-CoV-2, thus the need for the additional booster shot. Interestingly, in this Sheba Medical Center study, led by the director of the Infectious Diseases Epidemiology Unit, the study now expands, and a hospital spokesperson told Israel 21C that they will embrace the Moderna mRNA-based vaccine on a separate group of study subjects. They will test if mRNA 1273 has a superior impact to resist Omicron in healthcare workers that have already received 3 Pfizer-BioNTech doses. Now, of course, we here at TrialSite News will continue to monitor this situation as it continues to develop. So for the second story of the Roundup, we're going to talk about another instance of a COVID-19-based division in the medical community. A doctor has been fired over his refusal to be vaccinated. According to the HealthCareBusiness News, Dr. Joseph Auteri, who was the chief cardiovascular surgeon, was fired by Doylestown Hospital for his refusal to comply with the hospital's vaccine mandate. Dr. Auteri was also the medical director of Doylestown Health's Woodall Center for Heart and Vascular Care in Doylestown, Pennsylvania. The ousted physician reported that he already had COVID-19 resulting in natural immunity and requested religious and medical exemptions to the mandate, but both were denied. The doctor subsequently set up a GoFundMe page to finance a lawsuit against the Doylestown Hospital. Dr. Auteri claims that he had 2 difficult weeks with the disease, but after this bout with SARS-CoV-2 that he has gained antibodies and T-cell immunity. Now, according to the Bucks County Herald, Dr. Auteri claims his COVID-19 in May resulted in immunity and cited biblical passages saying human bodies are the temple of the Holy Spirit. And then there is the federal rule. The U.S. Centers for Medicare and Medicaid Services mandated in November that healthcare organizations must vaccinate their employees by January 4th. However, the mandate has been put on hold by federal courts due to lawsuits by several states. Doylestown Hospital has fired less than 10 employees who refused to comply, but also granted exemptions for 96 of their employees. Now, when Dr. Auteri refused the vaccination, he was immediately terminated. According to the doctor, he said that I declined the vaccine and was promptly terminated despite all that we've accomplished together. I feel what they did to me and other healthcare workers was wrong. Now, the Philadelphia Inquirer says most Philadelphia area hospitals have complied with the federal mandate. Roughly 99% of the 38,000 employees of the University of Pennsylvania's health system have been vaccinated. Now, Doylestown Hospital is aware of Dr. Auteri's lawsuit and his GoFundMe page. A spokesperson for the hospital said that Dr. Auteri is misrepresenting the circumstances of his firing. The spokesperson also said that the doctor was asking for funding for a baseless legal action, and that the doctor was one of the most highly compensated employees at the hospital. Now, in the meantime, we here at TrialSite News have been reporting on other doctors who have been fired for not conforming to hospital rules. Additionally, we have reported on the internal debate within the National Institutes of Health, or the NIH, over vaccination. Critics have suggested that if doctors are now questioning the government's vaccine mandate and are willing to lose employment, shouldn't more questions be asked here? This, at least, is certainly food for thought. And that, my friends, brings our episode to a close once more. As always, thank you so much for joining me on the program today. From TrialSite News, I'm Adrian, and I'll see you all